So again, good morning. I am Dr. Warner of Warner Orthopedics and Wellness. And today we're going to be talking about stem cell therapy, which is really talking about adult mesenchymal progenitor cells. I think everybody sort of says stem cells because it's one syllable and easy. Next slide. This is me. I'm a board certified orthopedic surgeon. I did a stint in the United States military active duty. I trained at Tulane for my surgical training. I've done a foot and ankle fellowship at Galveston. And right now I am running a private practice, which is a rare situation in the United States of America these days, but I do it because I can do a focus on wellness, which is my true love, and natural medicine and natural healing. And I don't have to be hassled by pressure from corporate entities or corporate partners or administrators to do X, Y, and Z. I can do what I think is best for the patients, which has been awesome. And I hope to keep this sort of freedom and autonomy because I feel like it's better for patients. So what do we do here? We do complete wellness. And my goal personally, professionally, for my family and friends is optimal aging. The alternative to aging is not a good one. We're all aging, and I want to do it in an optimal fashion that allows us to preserve function, vitality, beauty, happiness, and cognition, mental abilities. So we have orthopedic surgery, podiatry, physical therapy. We have amazing physical therapists here, and I work with them one-on-one every day too. All of our staff are highly trained. We've got a physiatrist who's very well versed in electrophysiology and the non-operative care of functional deficits of people. We have aesthetic wellness services because I think that if you look good, it helps you to feel good and take better care of yourself. And that's been shown in studies, so I'm not just making that up. We have infrared spa therapy, which is an amazing adjunct to any wellness program. We provide natural infusions therapy, and we obviously are able to converse and provide you with information about herbal and natural medicine and treatments and functional medicine, metabolic and hormonal workups for people, and guide treatment, sort of trying to treat the whole person and not just single joints one at a time. That's my philosophy, and that's what we do here. And we've been very successful. We're all very happy, and we just love it when our patients do well and age optimally. This is our facility. I actually have my offices adjacent to the physical therapists because I want to know how my people are doing and how their function's actually improving. I don't want to just have them disappear to an unnamed physical therapy clinic for months at a time, and then I don't really ever know what's going on. Plus, this way I can coordinate care very easily. And we try to make it very natural, very open, lots of natural lighting, lots of beautiful art so that people can feel welcome and feel healthy here. Very clean facility, and obviously we follow all necessary protocols. Next slide. Sorry. Okay, so let's get on to this topic, today's wellness topic. So the first question I get asked is, what is a stem cell? And it's a good question. Basically, like a stem of a plant and you have branches that come off the stem, that's all a stem cell is. It is the stem of which branches can come off cells. So these are specialized cells that you have in your body today, right now. There's some in muscle, there's some in bone, some in your bone marrow, there's a few in your brain, some in your skin. They're few and far between as you get older and older, but they're basically specialized cells that have the potential to change into a tissue-forming cell. So for instance, a stem cell could become a bone-forming cell. It could become a cartilage-forming cell. It could become a skin-forming cell, muscle-forming, et cetera, et cetera. And this is based on the environment in which the cell finds itself. So if a stem cell finds itself in the middle of muscle, it's likely to decide to become a muscle-forming cell. And also based on signaling, hormonal signaling, cytokine signaling, other chemotactic signaling from the body, and then the environment. Is it a high-stress environment? Is it a low-stress environment? Is the environment filled with oxygen? Is it not? Things like that. It's very complicated science, and honestly, most people are still looking at almost every aspect of stem cell science because there's a lot we still don't know, and we're learning, but it is amazingly promising. You can help treat conditions like joint, muscle pain, connective tissue disorders, fascial breakdown, anything that causes degeneration and programmed cell death, which is part of aging. Stem cells are very big in the anti-aging community. Anything that's chronically inflamed, it's used in injuries. Professional athletes are heavy users of stem cell treatments. So really, you can use it for almost any application because it is a universally applicable tool. Much like all of us breathe oxygen, and oxygen is used by every cell, you can affect chronically degenerative or damaged tissue by providing the building block of healing, which is a stem cell. So there's a few types. We're just going to talk about one of them in particular, multipotent, but there's totipotent, pluripotent, and multipotent. Multipotent can develop into a variety of different cell types, but not everything. Pluripotent can grow into almost anything. Totipotent can become anything. We only use adult stem cells, and that means all of ours are mesenchymal stem cells, which are multipotent. And here's an image on the bottom right of this slide is just one of many new products and devices out that provide stem cells for treatment of cartilage disruptions. This is applying a matrix, a liquid gel that's been meshed with stem cells into a cartilage defect to get it to grow back new cartilage. The picture above it is actually a micrograph stained, highly magnified of an actual stem cell. So why do we want stem cells? Well, in orthopedic surgery and musculoskeletal care, we actually have a whole term for this world called orthobiologics. We want interventions that use biology and cells because it's way more powerful than metal and plastic. And we can support the healing and repair of your normal body tissues better. So obviously, if you could find a natural injection that will help a tendon heal to a bone, that's better than a suture that never gets absorbed and never goes away. So the whole goal of the world of orthobiologics is basically to put the entire medical industrial complex out of business, if you look at it that way. Because in an ideal world, we would simply get an injection of stem cells or PRP, and you would never need to have anything replaced by metal and plastic. Cell therapy is when you put mesenchymal stem cells directly at the site of injury. So you're basically providing a therapeutic injection that is targeted. In other words, you wouldn't do an IV infusion of stem cells to try to treat a knee injury, although some studies with marked or radioisotope marked stem cells that they did do IV infusions shows that they tend to congregate at the site of injury. Why? Probably because at the site of injury, the platelets that are there are releasing chemical signals to the body that they need the help, and the body takes those signals and then uses it to focus all of the healing power to that area. And then there's another, I put another treatment on this slide just to kind of keep you updated on all the industry. Cardasim is a combination of human umbilical cord derived stem cells, which are mesenchymal adult stem cells derived from live donated after a live birth, the umbilical cord, which normally used to be just disposed of. Now we can use it to provide this amazingly powerful healing mechanism. They combine it with sodium hyaluronic acid, which is also sometimes called rooster comb injections, for the repair of cartilage damage. So they're basically combining HA, which gives the good signaling saying you're going to become cartilage forming cells, with the cells, and then they put that into the joint, and it really helps the cartilage to regenerate. So stem cell therapy is pretty controversial around the country, really. Around the world, not so much. Around the world, there are plenty of different stem cell places that are thriving. Most of the professional athletes here go overseas, in particular to Germany, to get their stem cell therapy treatments because the regulatory environment is less antagonistic to stem cell treatment, but there is some controversy, and I'll kind of get into that, and maybe you have some questions about it later. Most of the controversy is from ill-informed people who don't understand where we get the stem cells. A lot of people hear the term stem cell and they automatically think embryo, which is totally not the case, certainly not in this country. Pluripotent stem cells can be found in the inner mass of an embryo, but multipotent are found in your own bone marrow or adult sources. Our progenitor stem cells or medical signaling cells are from bone marrow usually, sometimes the umbilical derived type. Never embryos, obviously. A, it's illegal. B, it's unethical. And C, there's no reason to do it when you can harvest adult stem cells very easily and not even have to go there. However, this is being done in other countries, and if you're planning on traveling out of the country to get stem cell treatment because you find yourself in a state or a place where you can't do it easily, You might want to check and make sure that that other country isn't giving you that type of stem cell in case you, like us, have issues with that. So all of ours are adult mesenchymal stem cells. Not every stem cell comes from a fetus, and that's probably where most of the controversy starts. So we gather ours from bone marrow is the #1 place. I've been doing it for years and years in orthopedic surgery. We harvest bone marrow all the time to supplement bone healing because we know that it's osteoinductive. That means that there are bone-forming stem cells in bone marrow that can help us heal bones. Well, the same mesenchymal stem cells can be harvested, concentrated, and put into a knee joint to help the cartilage restore, a shoulder joint to help the cartilage of the rotator cuff. So basically, we harvest bone marrow, and then we process it with a minimal method using a centrifuge that allows basically just using centripetal force to separate red cells from white cells. And then you essentially can go through a process of centrifugation and gather up nucleated cells, of which a certain percentage will be stem cells. Not all of them. There's a very low concentration of bone marrow, so you actually have to get like 60 or more cc's of blood to end up with 2 cc's of concentrated nucleated cells, of which you assume a certain percent are mesenchymal stem cells. Or alternatively, there are many manufacturers within the United States who produce the umbilical-derived mesenchymal stem cell product, which is sometimes better than the adult product or the one derived from bone marrow because there's way more stem cells and they're way fresher. So in other words, it's not a stem cell that's been around for 60 or 70 years, sort of in a quiescent stage waiting to be turned on. They're very young stem cells, and a lot of scientists believe those to be more effective. So that's from a part of the umbilical cord, again, only after a live birth, only with the mother's permission, all donated. But you can find about 1 for every 100 cells of a mesenchymal stem cell that way, which is high yield. So the easiest way, the way that we've been doing since I can remember for at least a decade or 15 years or so, is you actually put a large needle into the hip joint, top of the tibia, the heel. There's different places you can get the highest yield of blood, and you pull off some bone marrow, and then you place it into a system that spins it out. You get your concentrated stem cells, and you transfer it at that same setting, same sitting. Usually this requires surgery and anesthesia because it can be painful. And then you process it at the same setting and inject it in the same setting. So it's all done at once. The processing part takes about an hour or so. And usually there's a little bit of post-op pain, obviously, from the aspiration, but it's really only about a 5mm incision. So it's not terrible. And we've developed methods to make it less and less painful over the years. But it's very powerful, very awesome. It's really pro-healing. A lot of people have started to call these medicinal signaling cells instead of mesenchymal stem cells because that's really sort of what a lot of it works, or the best way to describe how it actually might work. We think they might actually signal our own stem cells to more than they actually turn on themselves, but I'm going to get into that later. Mesenchymal stem cells from bone marrow don't always turn into bone-forming cells, so you don't have to worry about that. As long as you put them in the right environment, they should become that type of cell: bone, muscle, cartilage, etc. So again, these are concentrated autologous, meaning from you to you, homologous from one tissue type to the same tissue type. Do it in the same day, the same setting. It's just treated like any other blood product. And if it's in your scope of practice, totally able to do it. And that's the way we normally do things because that's the way we've been doing it for years and years in a highly effective manner. Sadly, most commercial insurance carriers still tend to call this experimental because you don't have to pay for something if it's considered experimental. And so the biggest downside to this is it's almost always a cash basis or a cash-based service because the insurance companies call it experimental. But it is allowed by the FDA as long as it's minimally manipulated in autologous and homologous. There's a ton of research being done everywhere in the hopes of getting the double-blind, placebo-controlled, randomized studies that the insurance companies want before they take it off the experimental list. Of course, this requires funding for studies, which you can't do if you can't have patients that have coverage. But some places are stepping up. California has a bond funded. In other words, they throw out bonds to the population. They get bought up by pension funds to fund the California Institute for Regenerative Medicine. They're doing a lot of research. There's a ton of research being done in Europe, Canada, the rest of the Americas, Middle East, Asia, really everywhere but here. And the National Institute of Health has actually provided $1.5 billion per year, which now that you see the numbers being thrown out for these rescue packages, you realize that that's not really a lot, but at least it's something, and our government is participating in a little way in studying these. So right now there's studies ongoing in spinal cord injury. There was a university out of California that just released data on injecting stem cells into recently spinal cord injured quadriplegics, and they actually had return of function. Not a lot of function, but they did have return of function to the upper extremities in these people. And the study is ongoing, so they may see even more. Heart disease, it's very controversial still, but again, a lot of research being done, and it's very, very promising for heart disease and muscle regeneration in the heart. Probably the most common place it's used, and the place that I use it, is joint degeneration, joint injuries. Again, like I said before, very, very prevalent in the world of professional athletes. A lot of professional athletes now are even doing this as a matter of course in the off season for longevity of their joints. Most of them do this kind of a treatment to avoid surgery. Plenty of athletes have left this country and gone to Europe to get this treatment because of the regulations here. If they wanted to do pluripotent, for instance, or if they wanted fat-derived or different ways that are considered more than minimally manipulated, they go to Germany, they go to Sweden, they go to South Korea, they go to the Middle East, they go to Costa Rica. There's a million places to go, but obviously that just leaves it to the rich and powerful. My hope is that eventually this will be a more democratized treatment that the rest of us can get in an easy fashion. But it's very, very common for professional athletes and people in the beauty space that rely on their facial appearance to get stem cell treatments on a regular basis. It's massively powerful for connective tissue, for ligaments, tendons, etc., as well as the cartilage, the muscle, and the bone. And it's very popular for skin rejuvenation nowadays. All right, we have a question.
Injections rather than steroid injection in the joints, asked Dustin.
The question was, what are the benefits of stem cell versus steroid injections in the joints? Well, the benefits of stem cells versus steroids is probably too numerous to list, so I'll just give a few. Steroids are just a chemical way to block the inflammatory pathway at a high level, like where the pathway starts. But they're very damaging to tissue, and over time they've been linked to increases in poor outcomes of surgery, cartilage degeneration, osteoporosis, depigmentation of skin, loss of muscle, and they're basically a good Band-Aid to provide temporary pain relief and to reduce inflammation, but they don't really do anything curative. Stem cells actually not only reduce inflammation because they're very powerful anti-inflammatory properties, but actually provide the only method to date that might actually heal cartilage back to where it was before. So there's no cure for osteoarthrosis to date. Just throw that out there. Know that nobody's figured out how to cure arthritis. But the treatment that offers the most promise right now is stem cell therapy. So basically steroids give you good pain relief, but so do stem cells. Steroids cause tissue damage, stem cells do not. Steroids don't last long, stem cells do. Really, the only upside to steroids is they're cheap and they're covered by insurance, my opinion. So moving on. So, and I know this slide is a little bit wordy, so forgive me, we'll do better next time. There's just so much information and I wanted to parse it out for you. So mesenchymal stem cells or medical signaling cells are massively exciting and promising. I mean, I just love learning about this. I read about it as much as I can. This technology is going to change the game. I predict in 10 years, a lot of the surgeries that are done now will be laughed at in the future because we will wonder what we were thinking. It is great for autoimmune disorders. There's a ton of research being done in this field to treat autoimmunity because mesenchymal stem cells have been shown to be very powerful immune modulators, and they sort of convert a damaging immune system to a more beneficial or normal immune system. You have to have some inflammation to live. That's how we fight disease. That's how we fight off pathogens and viruses. That's how we treat injury. But when your inflammatory system becomes overactive or active in the wrong way, that's when you have autoimmune disorders, chronic inflammation, lifestyle diseases. So if you can find a way to modulate that, that's very amazing, and that's what they're looking at now for stem cells. We've talked about some of the musculoskeletal aspects of this with meniscal repair, long-term damage, or osteoarthrosis. There's been some great studies looking at meniscal repair or meniscal regeneration, a lot of good animal studies that show the meniscus just comes right back, and even a couple human studies where you add stem cells to a torn meniscus or a meniscal repair, and it lets that meniscus heal. And again, for orthobiologics, it's an alternative to surgery. So most of the pro athletes that are doing this do it because they don't want a career-ending surgery. They know the extreme risk that surgery entails and the high rate of complications that really is with surgery. And so they want to keep playing. They don't want to have the pain. They want to be able to perform. And so this is a great alternative to surgery, which is really why I like it, because I want people to heal naturally and try to avoid surgery if you can. Again, these things exist in our bodies already. They're there for maintenance. They're there for repair. There's a reason they're in our bodies. All we're doing is providing more of them concentrated at a site of injury as they're needed in a targeted way. So it's sort of a way to harness and catalyze natural healing. So we have these in our body that to replace and regenerate local tissues that are lost to injury, normal turnover, and of course, aging. And nowadays, we have a growing elderly population, fewer people to support them and take care of them. This older population has been living a lifestyle of chronic disease, chronic inflammation. We have a high rate of diabetes and obesity in this country. We have a lot of problems. And our current treatment methods aren't the greatest. They're very inefficient. They're very expensive. So if you think of stem cells as being expensive, what they can be, so we'll say average around the country, it's $5,000 per treatment. Think about how many stem cell treatments you could get before you hit the cost of one total joint. So a total joint can be about $50,000 all in, and it may or may not work. There's about 20% rate of people being unhappy with a 95% survivorship of the implant. But stem cells, you could do one a decade and probably achieve the same outcomes, but it would be cash pay versus insurance pay, which is probably why the total joints win in the end. And of course, there's way more controlled double-blind studies of the total joints because they're covered. So hopefully we'll get more and more studies on stem cells and sort of show that natural is the way to go. We'll have to see. All right, so again, we talked about how it's immunomodulating and anti-inflammatory. This is one of the ways we think it really works. So the signaling cascade that comes off of the stem cells when they're injected in, just like when you do PRP and the platelets release their signaling molecules, the signaling molecules off of these mesenchymal, adult mesenchymal stem cells signal the inflammation world or the inflammatory system in your body to stop being a damaging inflammatory system and be more of a beneficial one. And then it'll actually modulate the immune system to quit attacking yourself, hopefully, and have more focused attack of pathogens and damaging tissue, and then to turn on more of the healing cascades rather than just the demolition part of inflammation, which is the damaging part. And we think this works maybe through cell-cell interactions, but really a lot of people are starting to look very closely at the exosomes or the secretions, the secreted cofactors, the chemokines and the cytokines that these cells spew out. And those are what might be really turning on and off the beneficial and the non-beneficial aspects in your knee and helping the cartilage to regenerate. All this is being looked at heavily at the basic science level. Again, a lot of it outside of this country. But we're pretty sure when you put a stem cell in the knee, it will change the local environment of that knee and make it less inflamed and promote more of the proteins that produce healing and then turn on the chondrocytes or the cartilage forming cells. So it'll actually activate your own endogenous, meaning in your own body, stem cells to become active in addition to them being there to begin with. I think we have another question. Hold on.
Can stem cells be injected into the ankle for neuropathy?
Question was, can stem cells be injected into the ankle for neuropathy? So this is an area that I think is extremely exciting because I have a very, very deep interest in neuropathy and peripheral neuropathy and how to treat it best. We see a lot of neuropaths and treat a lot of neuropathy here. Yes, in the short, you can. You can put injections of stem cells around a nerve. I probably would not yet inject it into a nerve. I don't think that's probably the way to go. Even when they do the spinal cord ones in those clinical trials in California I talked about, it's more in the space around the cord. Nobody's ever going into the cord. But yeah, you can target around the painful nerves, and hopefully those stem cells will reduce the inflammation and turn off the ectopically firing nerve cells, turn down the damaging neurotransmitters, if you will, and convert that chronically inflamed nerve, which has been damaged by the neuropathic process, into a healthier one. Do we know if it's curative? Not yet, of course. Do we think it's helpful? Yes. Okay, so I know this was going to be a shoulder pain stem cell talk, but the stem cell science in and of itself is so exciting. I just talk about that forever. But specifically for shoulder pain, and I've done this for different aspects of shoulder pain, sometimes it works amazingly well, sometimes it doesn't. But you can always go do the next treatment afterwards, as opposed to, let's say, if you go get a total knee replacement. You can't really rewind that and go back and get a stem cell treatment. The worst case scenario of stem cells is they don't work, and then you go get the treatment you were going to get anyway, but you might avoid it just like all the professional athletes do. So arthritis of the shoulder, rotator cuff tears, usually partial, this works really well for. Labral tears, which is the cushion around the socket part of the shoulder joint. Tendonitis, impingement. Believe it or not, the bursa in the shoulder is now being looked at as one of the best sources for stem cells. So the inflamed bursa that causes impingement pain when you reach overhead like this, you can actually harvest that, mechanically process it in surgery, and then put it back in and get an amazing source of stem cells. That's being looked at right now very heavily. And that to me is awesome, because if you're going in for shoulder surgery, why not add that? Better yet, maybe we'll figure out a way to harvest it in clinic and inject it right back into the shoulder. I think that's being looked at and worked on. So again, muscle and connective tissue problems around the shoulder. For instance, let's say you have a chronically firing trigger point that's been there forever in your upper trap, and it's giving you that pain right here that most of us have. Inject stem cells in there. Cristiano Ronaldo had stem cells injected into a hamstring tear so he could get back to his gazillion-dollar career, and it worked. So it's great for muscle problems like that too. He's a soccer player, by the way. Many people in Louisiana may not know that. I played soccer at Delaware briefly. All right, so again, the number one thing to remember, and one of the reasons there's controversy, is these don't work for everyone. So it's not a panacea. In other words, it's not a cure-all. It's a targeted group of people. You got to have a good consultation. It may or may not work for you. That's what we're here for, to discuss that and have a consultation. But when it does work, it's awesome. It's natural healing, and it supports your body's own ability to self-heal. So it just basically adds gasoline to the fire of healing within your own body. It suppresses the damaging inflammatory reactions that cause all of the chronic inflammation and autoimmune problems we're suffering from in this country. It skews the immune response towards that more tolerant, healthy, beneficial phenotype versus the chronically inflamed, damaging, rash, GI disturbances, pain, flushed, always hyped up in inflammatory response. It provides amazing pain relief for most people and recovery of shoulder function. Professional pitchers do this a lot to get back their power and their force. And again, cartilage has no ability, or a very limited ability, to heal itself as it is. So this is one of the only ways that we can provide cartilage a method to heal itself. Otherwise, all we're doing is cutting out damaged cartilage, cutting it out and replacing it, or poking holes in it to get blood to come out. Why? Because we think the blood allows some stem cells to get out there and promote natural healing. So this is one of the only ways we have non-surgically to give you a chance to heal a damaged joint or a damaged tendon or a damaged muscle. But again, it's not always going to work. And the problem is, because it's cash pay, and a lot of us don't have thousands of dollars sitting around like Rodriguez, A-Rod, when he flew to Germany to get his, you know, you got to make a calculated decision if you're going to go this route. So there are some studies looking at the stem cells for rotator cuff, I'm going to talk about in particular. So intratendinous, remember I said maybe not in the nerve, but you can go directly into tendon. So you drop, the bottom picture shows the arrow, that's where the supraspinatus attaches to the shoulder. So right here, okay, and that, the dark line is the rotator cuff sitting on the round sort of gray bone there. You actually use ultrasound in clinic and we can follow the needle in and in various places put the stem cells. And then they're inside the tendon. And remember I said the local environment plays into this? If you put them in the tendon, the odds are they'll be more likely to turn into tendon-forming cells than anything else, which is what we want. So there is an intratendinous injection study that was a well-done study with a 2-year follow-up, which is great. Reduced shoulder pain by 90% in these people with rotator cuff tears. And in the high-dose group, their strength improved by 50% over 2 years. Now, bear in mind, rotator cuff repair surgery, which is actually a very good surgery and pretty good success rates overall, the re-tear rate, so when they go back and look at people that have had their tendons repaired, is about 40% or so. So they re-tear and you lose strength and function, but you still have pain relief. Nobody's been able to figure that one out yet. But here we have a non-surgical way to improve strength and function and reduce pain dramatically. And the tendon heals, and you never had to have anesthesia. So more data or more studies, somebody put together what's called a meta-analysis, and that is a technique in science where you look at all of the papers that have been written on a particular subject, and you have criteria for what makes a good paper or a bad paper. You pick the good papers, and then you compare the good papers to themselves and make it sort of a bigger group. So you get a bigger sample size, right? Because statistics, you can make statistics say what you want, but the bigger the sample size, the more likely it is to be verifiable. So this meta-analysis in 2020, so recent, right, looked at applications to rotator cuff pathology, and they found improved load to failure of the tendon, which means it's stronger. Improved bone mineral density, which means it helped the bone repair too and become more youthful. Stimulated fibrocartilage and collagen formation. So that collagen formation is why all of the celebrities and models do it for facial reasons, to grow the collagen in a natural way to avoid fillers and whatnot. And then it improved the aspects of shoulder biomechanics. So to me, that says it made your bone better, it made your tendon stronger, it made your function better. And there is very positive response found in this meta-analysis for rotator cuff pathology injecting stem cells. The results can be variable, as with everything. And of course, different methods and different processing. We don't know how many stem cells person A has in their bone marrow versus person B. So there's a lot of variables, and all that's being studied right now. But in general, the results are promising, and the studies seem to bear this out. They think it's through the molecular signaling that we talked about, the mechanical stimulation. So you use the tendon a little bit, it stimulates the mechanical receptors in the tendon to turn on signaling and help the stem cells promote fiber-forming cells. And then we're also looking at augmentation with different devices and scaffolds and way to hold it in the joint. And remember, I told you nowadays people are even looking at taking the bursa out, chopping it up, putting it back in, and making that your source of stem cells when you repair your rotator cuff. So it's very exciting, very promising, and I think it's going to change the game, like I said before. So I'm a surgeon. I care. Why do I want alternatives to surgery? Well, I'm in a weird position where I would like to put myself out of business as a surgeon, because I think a lot of what we do is still pretty primitive and could probably be improved by a lot. There are risks of surgery, and people don't realize this. There's risks of anesthesia. If you have too many times of anesthesia, you can actually get cognitive loss. So there's risk of being on a table for a long time. The number one cause of neuropathies after surgery is positional, just being laid out for a couple hours. The risks of surgery here, I just listed a few. Number one, failure to achieve the goal of the surgery, right? You go in, you want your bunion deformity corrected. 2 years later, it comes back. Well, that's a failure to achieve the goal of surgery, right? Very common complication. Blood clots, we know this is a complication of surgery. Pain, different pain, chronic pain syndrome after surgery. Infection, a big risk, especially with diabetes. Anesthesia complications, we already talked about this. Death, a risk that nobody really likes to talk about with surgery, but it is a risk. nerve damage, revision surgery. So the revision rate of total joints is pretty high. One of the biggest problems facing this country right now is the boomers are all getting their total joints, and now a lot of them are in line for their revisions, which is a more expensive, more complicated, less successful surgery. Scarring is a problem. And so the risks of mesenchymal, adult mesenchymal stem cell or medical signaling cell injection therapy, the biggest risk, and probably the only risk, is failure to achieve the goal of the treatment. There's actually another meta-analysis that was just done, or I should say more of a big cohort study, where they looked at a few thousand people that have had stem cell treatments for MSK or musculoskeletal purposes, and there were really almost no side effects. The biggest side effect was a little bit of pain from the bone marrow harvest. So to me, this list skews in favor of trying stem cell therapy if you can, because the worst case scenario is it's not going to work, which means you're probably out some money, but you don't have this other list. Now, if it doesn't work, you can still go to surgery. It's always still an option. But one of the reasons I'm so excited and I love stem cells is because it gives us an option. It gives you a chance outside of surgery. So again, how do we do it? Normally in a sterile surgical suite, you can do this in clinic, but the needle's fairly large and you would have to put a significant amount of local anesthesia, which some people believe might actually kill the stem cells. So you have to be in a sterile environment. Usually we sort of do what's called conscious sedation and kind of make you a little bit unaware so you don't really feel what's happening. You draw the bone marrow out, about 60 cc's of blood, so 2 big, huge syringes, pass it off to the back table where there's a vendor with the equipment. They process it in a minimally manipulative way, so with just a centrifuge. You pass back the 2 cc's of concentrate, and then you inject that wherever the target is. Is it your knee? Is it your shoulder? Is it a muscle? Is it your ankle? Is it around a nerve? And mesenchymal stem cell therapy is being offered at almost every major medical center in the country right now. Hospital for Special Surgery, the Mayo Clinic, the Cleveland Clinic. A lot of athletes go to the Intermountain Stem Cell place. We do it. I mean, this is being offered everywhere right now. So this is not a fly-by-night process, although there are some fly-by-night clinics that you should be aware of. So our injection protocol, and the 2 pictures here show you ultrasound. You can sort of see a hint of the needle on the bottom one the best. You can actually visualize exactly where you're going and where you're placing this biologic treatment with ultrasound, and that's probably the best way to do it in the office setting. Sometimes we supplement it with platelet-rich plasma at the same time, or we do platelet-rich plasma added about 4 weeks later to give it a little bit extra boost. Sometimes we might recommend additional cytokines or taking alpha-2 macroglobulin, which is another awesome treatment for joint pain. It's basically a concentrated liver protein that eats up all the damaging cytokines of painful inflammation. We usually recommend physical therapy to optimize your biomechanical function, because just like, let's say you have a car with a flat tire and let's say you're out of oil. Well, if you just fix the oil, but you don't fix the flat tires, you still don't have a useful car. So you might have a damaged joint, but let's say you also have a very tight medial hamstring and your peroneus longus doesn't fire right and your hips aren't moving and you don't have good balance. We'll work on all that at the same time that your body is doing the natural healing with the help of the stem cells, so that when the joint does get better, your leg is better able to use a better joint, if that makes sense. And then if we're going to use the umbilical-derived product that we get from various U.S. manufacturers, again, we do it in clinic and we do it with an ultrasound. That does not require anesthesia, conscious sedation, or sterile setting, or putting a large needle in your bone. So that's the alternative way to do it. And again, there's just no successful outcome guarantee, and we're very upfront about that, but it's a chance to avoid surgery. So again, sometimes it's more desirable to use what we call allogenic versus autogenic. So sometimes it's just not practical to draw bone marrow. Sometimes somebody might not want to have that sort of a procedure done or have that kind of pain. And the older we are, you can assume there's fewer and fewer of your own stem cells in the bone marrow. So you might want a source that's got way more, like we're talking a few million stem cells. And that's when people go to the umbilical derived, which is, again, still adult mesenchymal stem cells, but just allogenic, meaning from a different person. They're processed, they're sterile, they're immune privileged, they don't induce an immune reaction, so you don't have to worry about all that. It's a much more convenient and powerful way to do this. But the gold standard and the way we've been doing it for years and years is really bone marrow derived. So again, the biggest problem, sensitivity at the injection site or the draw site, right? That's your biggest problem. Usually that's mild, usually it's short-lived. I let people go back to their normal activity after about a week, really, with few restrictions. I do recommend that if you do have a biomechanical problem, like we talked about, that be addressed at the same time to give you your best chance of full and total recovery. And then most people notice a change around 2 weeks or so, but you really don't really know until about 6 months or so, because this continually evolves. And that's why the studies that I like to look at are 1, 2, or more years out, especially the MRI studies that show cartilage actually returning to knees, for instance, that you don't see that change until about 2 years later. So once the stem cells are incorporated and turn on the healing in your body, it is on and it continues to heal, assuming that you do the right, do the stuff you need to on the side, which is eat better, sleep better, hydrate, things like that, the basics of having a good optimal life. Again, it doesn't work for everyone, and you should not think this is a miracle cure, although it probably will be in the future. There's just too many unknowns right now. We're not 100% sure who's going to always respond to it versus who won't. So it doesn't work for everyone, but it does work for a lot of people, and it's pretty awesome when it does. And you can still go have surgery if it doesn't work. But again, it usually doesn't work in the reverse. If you have surgery, you can't go back and change your mind. And that's one of the issues with surgery, right? So we'll do a consultation. A lot of times what I like to do is get an MRI of the joint pre, and then ideally a couple years later, sort of measure the difference. You want to make sure that you are someone that might actually have some stem cells in your system that would be beneficial to you. I usually try to make sure you know and understand there is no cure for arthritis, and a lot of times you might really need a joint replacement. But if you really don't want to have a joint replacement or have surgery, this is something you can try, and you don't really lose anything but money in the meantime. Maybe some time, I guess. And then we may decide that we want to do bone marrow, and that might be the best option, or umbilical derived, or maybe PRP is the best option. If you're young and healthy and we think there's a lot of your own stem cells floating around, sometimes just going to PRP, which was much more affordable and easier to process in the clinic. Sometimes doing platelet-rich plasma draws in your own stem cells, and that's a way to harness this power without having to pull off a bunch of bone marrow. And then once we have the consultation, we'll talk you through the process and make sure you're optimized. We try to get you on the right nutrition program, get you on the right exercise program, hydration, et cetera, to give you your best chance of recovery for this powerful biologic method. Okay, we have a question?
I had 2 arthroplasties on my right shoulder. Do you think stem cells would be helpful?
Somebody asked, I've had 2 arthroplasties on my right shoulder. Do I think stem cells would help? I don't know if they're asking about the right shoulder or the left shoulder, but let's say the right shoulder. If they've had an arthroplasty, which to me means the joint was replaced, I don't see how a stem cell would help because the joint is now metal and plastic. All right, so again, our protocol, we'll perform the injection using standard sterile techniques and try to make it as less, the least amount of pain as possible. We use topical anesthetics, things like that. And then we'll work with our very highly trained physical therapy team to design a protocol for you, for your specific problem, to allow a good biomechanical environment for the stem cells to work, or the PRP. And then any adjunctive treatments like we talked about, the alpha-2 macroglobulin, the PRP, any nutritional supplements. You might be depleted in zinc. You might be depleted in testosterone. We can do a full metabolic, full vitamin workup and try to optimize your inner milieu or your inner paradigm to promote the best results from this treatment. Really, I want everybody doing what these folks on the right are doing. I want us all doing yoga and living a beautiful life on the beach. Maybe we'll all get there one day, but first you got got to get your body working as good as possible. It is your temple and it should be treated as such. And I think this is an amazing technology with massive potential. And I'm going to keep my eyes on it for you and update you as necessary. And thank you so much. Please share this with your friends. As we said before, if anybody's interested or has relatives that might have a painful joint and maybe just don't want to go through a very expensive, risk-prone surgery that requires anesthesia. Anyway, we can at least answer questions and have a consultation. I love talking about this topic. And have a great weekend. Oh, we have a question. Hold on.
Gina wrote back, I'm sorry, that was supposed to say arthroplasty of the right shoulder, no replacement, still have much shoulder pain. Arthroplasty.
Oh, I think the person that asked about the arthroplasty, perhaps they meant arthroscopic surgery. So they had a shoulder scope, it sounds like. No replacement, so they still have their native tissue. Would stem cells help? In theory, yes. Of course, I'd have to see the MRI, the x-rays, do an exam, that sort of thing. But in general, if there's still tendon in there and if it's not fully torn and retracted, then yeah, it could help. At the very least, it's powerfully anti-inflammatory and it can completely convert the inner joint environment from an inflamed one to a not inflamed one and make it less painful.
While you process of that, I have a question from Vicky.
Another question.
Will Medicare pay for PC? Is the cost comparable for bone marrow or umbilical cord stem cells?
The question is, will Medicare pay for physical therapy? Yes, to a certain limit. In their infinite wisdom, CMS has determined that Medicare recipients deserve only a certain number of physical therapy visits a year, which is mind-boggling to me because in theory, the Medicare population probably needs the most physical therapy. But a lot of plans cap out at 21 visits annually. And then you've got to go pay for it yourself, unfortunately. But they will pay for it to a point. And then is the cost similar between the bone marrow derived and umbilical? It depends on the amount of both, right? So generally speaking, we try to do these procedures for under 5,000. You know, nationally and internationally, you can find this done for 50,000 a pop, 20,000 a pop, very easily. We try to limit that cost, which means, how do I explain this? The umbilical derived, it can come in a 1 cc, a 2 cc, a 3 cc, a 4 cc. You can mix it with what's called polycyte, which is derived from the amniotic tissue that gives it a more supportive environment, and that increases the cost. So the umbilical derived can range from anywhere from 2,500 to 10,000, we'll say, depending on the size of the joint and whatever else you mix with it. The bone marrow derived is usually around 3,000, 4,000 or less, depending. I probably didn't answer that question well. It totally depends. All right. Well, hopefully that gave you some information. There's tons of information coming out on a daily basis. I'll probably talk about this again later this year as more studies come out and more results. But by and large, this is a very promising, hopeful thing for human health. That I think is going to be very powerful and change everything about healthcare. Oh, if you want a consultation, you want to talk about this or learn more, you can always call and make an appointment with us either online or just call our office, 225-754-8888. And we can even potentially arrange a telehealth consultation if necessary, if you're from far away. But again, I love talking about this, so I'll answer any questions that you might have. Thank you, and I'm signing off. I'm going to go do paperwork, and hopefully you guys will have a great weekend.